Alicia Cole had been active all her life. However, in 2006, she had routine fibroid surgery.
So the next step is we're going to locate the uterus.
5 days later, she was in agony.
My abdomen was flaming red, and it was hard like cement, and it was on fire.
After just a few more hours, the infection was so out of control, she was near death. It was the beginning of a 7-year nightmare.
2 months in the hospital, a month in ICU, 9 blood transfusions, 6 additional surgeries, almost having my left leg amputated, and over $2 million in medical bills.
Serious infections strike 12,000 surgical patients every year. Among the worst involve patients getting hip and knee surgery. The infections have many causes, but now over 4,000 lawsuits allege one cause is this heating blanket used in 80% of operations. You see, operating rooms are cold, good for surgeons, but bad for patients. Dr. Mark Silverberg has been a practicing anesthesiologist for 30 years.
The coldness is a real health hazard, so there are companies that developed ways to keep patients warm when they're undergoing surgery.
Lawsuits allege these devices actually cause infections. How? Their forced air comes out of these holes. Lawyers say that swirls up contaminated floor dust right onto the surgical wound. But Dr. Silverberg believes the Bair Hugger really causes infections another way. He says shivering OR staff routinely put the device's hose under their scrubs to warm themselves.
If you're taking your shed skin cells, which are covered in bacteria, and having them float out throughout the operating room, there's a very good chance that these are landing in the surgical wound.
Dr. Silverberg says even though some hospitals have banned the practice, it still goes on.
You're stuck in an operating room at 60 degrees. You do whatever you need to do to try to keep yourself comfortable while you're doing your work.
But Dr. Silverberg has invented another, safer way the OR staff can stay comfortable.
The company I have is named OperationHEATJAC.
These are warming belts that OR personnel wear around their torso and under their warm-up jackets or surgical gowns to keep warm. This device contains air-activated warming packets. This device plugs into an outlet. And this warming belt runs on batteries that last 5 to 13 hours, depending on the warming setting.
Oh, people like it. It's really well received.
The cost? From $105 to $380.
You're weighing those relatively small costs against the astronomical cost of a surgical site infection.
Exactly.
The anesthesiologist stresses the Bair Hugger itself is safe. Any danger comes only from its misuse. But he says that misuse can be disastrous for infected patients.
The most important part is patients are experiencing pure misery.
My life is completely different. Track, bowling, you name it. So that's real hard.